We are going to try this Facebook Live once again. Hopefully someone will join. I am now out of the gym and back home. Had technical difficulty before. Had technical difficulty before, and while I was at the gym, got like 18 inboxes saying, "We missed what you said, can you redo it?" Hi, Marcus, Melinda. So I am back on. This is going to be a quick Sunday afternoon Facebook Live. I apologize for the technical difficulties before. Yeah. Was trying to do it in the car, couldn't get great Wi-Fi. So tonight we're going to cover quickly, again, just home from the gym, and just as I'm looking at myself, I usually don't work out in makeup, but I didn't take off church makeup, so that's a good tip, so I could talk to myself. Actually, when you work out, you should actually have your skin open, pores clean, and you should not work out in makeup. So don't do what I did today, and what I usually don't do is work out in makeup when you go for your walk. This ain't no beauty contest. You can put on some lip gloss, but you need to work out bare face typically. Hi, Katrina. So this is Dr. Sharon, Allison, ottey. Let's hit some Facebook Live health and wellness. If you have questions, go ahead and answer them. I'll answer them on anything that I can and tell you if I don't know. So I never really have a script. I kind of know I'm answering your questions from the week, and I'm doing some highlights on particularly October is Breast Cancer Awareness Month. There is not a woman alive, a man alive that does not know someone that has had breast cancer, whether in your family or not. And so breast cancer is one of the leading cancers in women, actually the leading cancer in women. But what cancer actually is the leading cause of death? Y'all answer that. What cancer is the leading cause of death in women? Is it breast? Is it something else? Y'all tell me. And if I forget, I'll tell you by the end of this session. So this is Breast Cancer Awareness Month. Hi, Mario. Debbie. Hi, everybody. So the other thing that I want to quickly talk about tonight is domestic violence. This is also Domestic Violence Month. And as I said in my Facebook post or live post that kind of I deleted it because it was too much buffering. It is not only women that are victims of domestic violence. Men are victims of domestic violence, and we need to make sure that we share that. Men typically often are a little embarrassed, or they just suffer in silence, but men are victims of domestic violence as well. And so we need to make sure, and I say this in talks, particularly to women all the time, if you can throw a punch or a slap, you need to be prepared to take a slap or a punch. And no one should be hitting anybody, right? And so, and in domestic violence is not just physical abuse, it's emotional abuse. And so often the most powerful weapon we have is our tongue. I'll be very transparent. I grew up with 4 brothers. I couldn't beat up my brothers. I couldn't. But I was always sharp-tongued. So I would say things to them that would get them. And then they'd punch me in the arm or whatever. But anyway, it really is physical, emotional abuse. And we should actually make sure that when we talk about domestic violence, we're not just focusing on women, although that is very important, and what we see the most. It is also taking time for us to also open the door for men to talk about domestic violence and their abuses, and to do that in a safe place, okay? So domestic violence, October is Breast Cancer Awareness Month. And then we have to talk about all cancers. Has I say all the time, the American Cancer Society, I sit on several of their boards and do a lot of lectures around the country for them, on behalf of them, and appearances on behalf of them, talking about cancer, teaching people about cancer, teaching health professionals about cancer. And it's really important. One thing that we don't talk enough about is colon cancer. The colon is basically our how do I say this in Dr. Sharon form? When you eat food, it goes down the esophagus, which is the throat, hits a part of the stomach, which has a little sphincter. The stomach is a pouch, right? And that has muscles, actually. That's how food moves. And then it goes to the small, large intestine, colon, and at the rectum. So your colon is where all your food gets digested. The stomach is basically starts it. Well, actually, when you smell food, this is a tip. When you smell food, or you start to smell food, you actually start the digestive process. Did y'all know that? When you smell food, the body says she's getting ready to eat, get ready to release some hormones, some enzymes, so we can break down this food. Our bodies are so well made. Anyway, so colon cancer is the third leading cancer in both men and women, and often we think about it as a man's disease. No, it is both. So, getting back to, hi LaDonna, hi Terry, hi Ed, but getting back to breast cancer, if you know a woman, number one, if you have breasts. Number two, if you know a woman with breasts. Number three, if you have a mother or aunt, sister, anybody, wife, child that you love that has breasts, you need to know about breast cancer, right? And men, if you have man boobs or breast cancer or chest, the pectoralis muscle is the muscle of the chest, but then there's a little fat over it. So, you know, there's some men walking around with D cups, I'm just saying. But anyway, it really doesn't matter the size. Men actually can get breast cancer as well. So this is what we need to do, and this is what I still recommend. And it is very, very confusing. But if you have boobs, get a mammogram, particularly after 40. And if you have breast cancer in your family at 35, if you have fibrocystic disease, guys, say one big word so y'all know I am a doctor. Fibrocystic disease is cysts basically in the breast. So when you have your period, they get a little tender, they may get puffier, and all of that. You may have, and if your doctor said you have fibrocystic breast, that does not put you in increased risk for breast cancer. Okay? It does not. But because you have different lumps and bumps, it's hard to tell what is a real issue or not. This is the key for breast cancer. Number one, feel your breasts. It ain't masturbation, whatever, which ain't nothing wrong with that. It's not masturbation or anything like that. But it is, you are sitting down or laying down or in the shower. I actually usually say you should lay down, put one hand behind your head, examine the breast without a bra. I got a question about that. Without a bra. And you all can ask me any questions. There is no dumb question. You should see what I sent to my mechanic on Friday. He was like, just tighten up the cap. But anyway, without a bra, laying down. And you can just Google it. If you're on Facebook, you're on a computer, Google it on how to examine the breast. This is what is abnormal. If you feel a lump that is new, for you to know it's new, that means that you did your breast exam before. But a lump that is new, and when you press down, it feels hard and it's not moving, that's an immediate call. Doesn't mean you have cancer, but it means something is different. Breasts are squishy, breasts are lumpy. And so you should know your breasts. If your doctor examines 1,000 patients a year, that would be 2,000 breasts. Okay, they may not know, or she may not know them all well, right? But if you have only your breasts and you're examining them, then you know your breasts and you should examine them at least once a month. That still is a recommendation that I and most health professionals make. And your mammogram should occur. And men, I want you to stay on and listen, because you should be telling women, have you gotten your breast exam? Okay? And you should know if you feel a lump in your breast to go in. Even if you feel a cyst in your breast, you should go in. Anything abnormal in a man's breast, you should go in and be seen. So the other question that I get a lot is, do I still get a mammogram? We've heard about these wonderful other tests. Mammogram is baseline. And then talk to your doctor about a compression ultrasound and other tests. And then know your daggone results. Come on, people. People get blood tests, ultrasounds, CAT scans, MRIs, all that, and then say, well, they didn't call me. I say this at least 4 or 5 times a year on Facebook Live. They didn't call me. What if the tech didn't call you or your labs didn't get over? And you sitting around with something, you did the test, get the results, and then know what they are. Shout out to Huffington Post. I had an article, I was interviewed for an article on Huffington Post. Look on my timeline. It's on, and it talks about being misdiagnosed by your doctor, or how you effectively maximize your doctor's appointment. Dude, look at that. It's on my timeline, but it's also on Huffington Post. Just put in Huffington Post, Dr. Allison, ottey, and that interview will come up. There's another major interview coming out this week with another major newspaper. I'll let you know when. But it really is, get your lab test and understand. Even if you have to say, I'm going to go back in, yes, and pay my $10 copay for this professional to tell me what's going on with my body. Come on, I can't say it enough. So we talked about breast cancer, talked about what you need to do, and we need to talk. You need to talk to people in your family, find out if there's a family history, but not necessarily everyone with a family history is going to get breast cancer. I get questions a lot about should you get genetic testing or not. That is something to have a discussion with your family about. Well, your family and your doctor, number one, about whether you should get genetic testing for breast cancer and a bunch of other stuff. So now, talked about domestic violence, both in men, perpetrated by men, and perpetrated by women. And I need to go back to that and say that also you have gay and lesbian, LGBT community actually has very high risk of domestic violence. So let's not just make assumptions. Everyone is at risk, and let's get it together, okay? Questions that I got this week, and certainly if you have questions, I am taking your questions tonight, but this is going to be quick. I got a question on, number one, everybody please look at my post from this week on flu versus cold. It is flu season. The first cases of flu have come out. And so please, for most people, unless you have an egg allergy or other allergy, or have had a very bad reaction that's medically documented. I'm sorry, I went to the gym, so that's medically documented, you should get the flu vaccine. I think it's now that Centers for Disease Control said 6 months till death. Get a flu vaccine, and then make sure grandma and grandpa, mama, whoever are older persons, make sure they have what's called the pneumovax, and that's PNEUMOVAX, the pneumovax vaccine, which is for pneumonia. They get that every several years, okay? I don't really have a script, so I'm trying to remember what I need to remember and tell the good people. If you have a question, you can inbox me and I will get it right. So number one, you need a flu vaccine. Period. Flu don't give you flu. Look at my pose now. We get crazy. The flu does not give you the flu. Okay? It doesn't. You may have had the flu and it was cooking, and then you get the flu vaccine. But we get the flu vaccine. And how do you know if it's a flu versus cold? I did put a chart on my page. But basically, when you get the flu, you feel like you've been hit by a Mack truck. You feel horrible, like Jesus getting ready to come get you right away, right? But we go through whether there is, how is there a bug out in this night on my patio? I'm just saying. You feel like a Mack truck has hit you, okay? And then cold. And then practice good hygiene. Wash your hands. If you blow your nose, number one, wash your hands. Put the toilet tissue in a safe container, all that. You don't know what your co-workers, your family doing. Wash everything, walk around with hand sanitizer, whatever. Okay? And you definitely don't know in a restaurant what people doing in the back. Okay, so get the flu vaccine. Now, the other question that I got this week was on autoimmune diseases, and I have gotten several of those on the last couple of Facebook Lives. So let me, not Facebook Lives, just questions that I get, and I do still answer all of my own questions. Number one, let me explain what an autoimmune disease is. Autoimmune is AUTO. IMMUNE. Our body is so wonderfully made. We have our own little system that takes care of if you get a cold, if you get an infection, your body revs up to go fight it. It's our warrior system. Well, I'm sitting out on my patio. I don't do this enough. I don't ball this stuff. I'm just saying, my little lights coming on. That's cute. But anyway, sidebar, y'all know I'm crazy. So, your autoimmune system is your body's way of fighting disease for you. So, and it recognizes what's called something foreign coming into your body. So you get a cold, says, hey, wait a minute, you ain't supposed to be in here, so let me rev up and get rid of you. That's what autoimmune is. The problem with the autoimmune disease is it begins to recognize your body has not normal. So with rheumatoid arthritis, it says to your joints, hey, these joints are supposed to be here. So now, is that a deer in my backyard? Jesus! I'm gonna have to get off the patio. Is that a deer? Bambi in the back. What's that? Lord. Okay. Whew. Bambi in the backyard. I sprayed that deer protection. Anyway, what was I saying? Autoimmune disease. LaDonna, Bambi in the backyard. Okay, autoimmune disease. So, with rheumatoid arthritis, you don't recognize your joints. With sarcoid and lupus, which are autoimmune diseases, i.e. the immune system. That's my little neighbors being a little loud. That is the immune system saying, if it's sarcoid, to your lungs or other parts of your body, hey, let me fight this now. Let me make some hard tissue called fibrous tissue. Let me get connective tissue and let me fight it. Right? Because this is not supposed to be here. And then with lupus, that can affect skin. It can affect anywhere. It's the same. You start to fight your own body. So that's what autoimmune means. And you would get tested for autoimmune disease. And there are several other autoimmune diseases. The other question that I got was based on another post called about meningitis, where I said if you have college students, make sure that they have the meningitis vaccine. And this is key. Because the meninges, meninges, are the lining of the brain, okay? It's the lining of the brain. And when they get infection, it is itis. So in medicine, itis means infection. So meningitis, right, is an infection or inflammation, let me be clear, or inflammation. So the meninges get inflamed due to they get mad. That's what inflammation is. Arthritis is an inflammatory disease. Your joints mad at your behind, right? All right? You have inflammation. They mad. So it's best to just break it down. That's what I believe. So anyway, so if you are in a closed situation like college and one person gets meningitis, it is highly contagious and can be life-threatening. So if there's an outbreak, do get the vaccine. And then I did say again, please do not talk about getting the flu vaccine and I got the flu when I got the flu vaccine, because that does not do you. No, boo-boo. You ain't get the flu from the flu vaccine. Okay? And then the other question I got, diabetes, and this I'll close out with unless I see a question from you guys. I talk a lot about hypertension, heart disease, high cholesterol, and I hit diabetes. Diabetes is basically two reasons you have diabetes. One, you were born with it. So insulin is the car. Think about this. Is the car. Hi, Stacy Tucker. Is that my cousin Stacy? Is the car that drives around glucose, the sugar. Okay? If the road gets longer, i.e., you gain weight. It is harder to get your little cars to drive on more territory with sugar, right? So how do you do that? Or if the car get old and get a little raggedy, then you have impairment. It's not able to be as efficient. That's what it is. Think about insulin. Diabetes as insulin, which all of us make, and glucose is sugar. So you either were born with defective insulin, messed up insulin, you can't take the glucose around. You will always have to have typically insulin artificially given, or you develop it because you gain weight, or you have other conditions. You take steroids. Steroids can induce some insulin issues and some glucose issues. These are the tests for diabetes. Number one, a fasting glucose. Fasting sugar test. That means you have not eaten for 8 to 10 hours before you go to the doctor, get your glucose taken. You want that to be well under 100. Or you get a random glucose, and then they'll tell you to come back and take it and test it again. If at all possible, when you're going in for blood work, if possible, go in fasting. So you haven't eaten in 8 to 10 to 12 hours, so that you ain't got to come back. Okay? Okay, for cholesterol, diabetes, and that stuff. And then 2, and it's getting darker, and something's biting me, so I'm getting ready to go. And Bambi is over in the corner. So, yeah, this little outdoor thing getting ready to end. But 2 is, when we talk about diabetes, there's also, if you have diabetes, a hemoglobin A1C. HbA1c. That test over 3 months, how have you handled glucose in your body? Diabetes is a disease that affects you from the top of your head. You can have hair loss to the bottom of your feet. You can have nerve damage to your feet. It should be noted that with diabetes, diabetics, you need to look at your feet all the time. You need to inspect between the toes. You need to look at your feet, because we still have amputations from diabetes in 2018. And that is because your nerves basically get burned out. Sugar outside of insulin and outside the blood vessel is toxic to your body. So too much sugar spilling over to your kidneys, to your nerves, to all of that, to your eyes. Blindness, diabetes is one of the leading causes of blindness. So anyway, diabetes is very important. How can we combat it without medication? Number one, diet, less carbohydrates, less sugars, and more whole foods, and watching our weight, and exercise. You know, it gets boring, y'all say, but it is. Most of the things that we talk about can be controlled with diet and exercise. It is getting dark out here, even though I have these little low lights. I'm just saying, I've seen a deer in my backyard, and I love y'all, but you know, I ain't too keen with the animals. I ain't no veterinarian. I can't play with Bambi. So thank you all for joining. I will post this. Send me always your questions. To recap, we talked about domestic violence, both against men and women, and vice versa. We talked about breast cancer. We talked about autoimmune disease, what that means. And we talked about diabetes, meningitis, flu vaccine, and cold. We talked about a lot in a little bit of time. I hope these help you, but it's getting dark. Dr. Sharon got to go in. Bye-bye.